Hey everybody, I'm Maggie and we're back on SRH Access, Facebook Live. Today I have the privilege of being with one of our pediatric psychologists, Dr. Heather Richard. Welcome.
Thank you. I'm really excited to be here.
We're excited. This is our first time to really get an inside look at what our psychology department does with our patients and how they work with our healthcare team. So to kind of get things started, can you kind of give us an overview of what the psychology team, who's all involved and what that looks like?
Sure. We actually have the privilege here at Scottish Rite of having our own psychology department, and psychology has actually been here as part of the hospital for, decades. And we're leading this idea of pediatric psychology in a pediatric setting in this region of the country. And now we have expanded. We have 4 pediatric psychologists on our main campus downtown, and expect to have pediatric psychologists available also at our new Frisco campus when that opens in a few months. Pediatric psychologists are clinical psychologists who have special training working with children, but children and families who have, children who have medical conditions and how that impacts them in school, their families, how they cope with it, pain management, and related things that can come from taking medications for a long time or having prolonged treatment. And so we have the privilege here of being able to work with all of our medical teams. We're very involved with our orthopedic team. We work with them specifically about getting kids ready for significant treatment, big surgery, long surgery or long treatment. We often have surgeries that maybe the surgery is a big part, but then the rehabilitation is so much a part of what the patients have to do, and they have to go home and add to their daily lives exercises or taking medicine, while also making grades and having friends and trying to be normal if they can. We work with our rheumatology team quite a bit. We have a lot of kids who have conditions like juvenile idiopathic arthritis, and they take a lot of medications, and that has side effects. But they also go to school, and they want to be normal, and they want to do activities just like their friends. And so how do they do both things while having a chronic condition? We work with our pediatrics team. We have a lot of kids who have chronic medical condition, but they also have differences in how they think and how they go to school and how they function. And so how can we best help them adapt to changes that may be part of their medical condition or changes that come from an acquired medical condition? We also work with our neurology team as well for similar reasons. So we see patients in clinics, most of what we do, because that's where our families are. And so it's a really big part of our job and our role here. We want to meet the patients and families where they are. And they're ambulatory care patients first. They come to see our physicians and our teams first, and we want to be part of that team.
Right.
And we have an awesome relationship with our physicians to be able to collaborate in clinic and say, hey, how can we all look and see what we can do to help this child and the family? Because one of our missions, is to help the whole child.
Definitely.
And so that includes lots of disciplines, and we're excited to be part of the treatment team in the clinics because that's where our families are seen in the first place.
For sure. And especially as a parent who, this is going to be their first time coming to the hospital, they're not really sure what resources are really offered to our patients.
Sure.
What can you tell parents, or what can they be aware of that when they're coming and maybe they do think that it's something that they might benefit from or their child might benefit from? How does that work in terms of how that gets set up with psychology and with the doctors?
There are lots of different ways, primarily just asking the question. We're able to see any patient and child who is a patient here at the hospital. And so really it's just about asking, and it can be anything from my child is having a hard time at school right now to, oh my gosh, we just learned that my child has scoliosis, or now I have to wear a brace for my scoliosis, and yesterday I didn't have to wear a brace because I didn't know I had scoliosis.
Right.
And those are huge adjustments. But it can even be things like my child worries a lot, or they have a hard time sleeping, to, it seems like how things are going at school has really changed. Is there anyone who can help? And we are available to at least have that consultation to say, well, what is the concern that you have, and how can we either manage it here as part of your treatment at Scottish Rite, or is it better that you see someone locally in the community because that's where you live and that's going to be
Right.
more appropriate. But we'd be sure happy to help set that up too, so that the access is at least there. So really, it's just asking the question if we're not already available.
So you were talking about all of our trained psychologists that we have here. Do you have, is each person kind of specific to a certain area within the hospital, or, with these patients, obviously a relationship has to be built here, because I'm assuming that, these kids are going to be seeing one of you guys more than just once if need be.
Sure.
So is that something that's consistent, or are they, would they maybe see you one time and then another psychologist?
No, that's a good question. We are fortunate to have psychologists for each team. And so that not only does the physician know exactly who the psychologist is they're working with, but that allows for that collaboration in clinic. It allows for good communication, but it is allowing that consistency also for the families. So sometimes I see patients in clinic many more times than I would see them in my office, because it's more appropriate that we're having that conversation as part of the treatment team. And then when it becomes necessary or something changes or we're talking about different things, then they might come up to my office and spend some more formal time with me as they need to. But it's the same psychologist with that team to create that consistency, that rapport, and that relationship. And that the family and the patient don't feel like, oh, I'm talking to one person and then I'm talking to another person. But just like when they come here, there's that predictability of that physician who they're seeing. We like to have that predictability as well as the psychologist they're working with.
Well, it's such a relationship building thing. It definitely is like making them feel comfortable and at home. People that come to Scottish Rite always feel like they want, they almost want to be here because they feel like it's such a family. So I definitely think that the psychology is such a big piece of that. So I'm really happy we get to talk about that.
I think the greatest compliment that I have working here is when a patient seeks me out to say hi to me, or when a patient or family come and give me a hug, even though they don't need to see me for any clinical reason, because I'm the psychologist, and it's like, well, maybe not all people think it's a good idea to see a psychologist, or what goes along with that, or it may not feel comfortable. But when a family seeks me out or asks to see me or just wants to say hi, that is the biggest professional compliment to me. Because we've done something right as an institution of creating that relationship and adding to that home, and adding to their care.
Right, and you've made an impact.
There's an impact there.
That's awesome. Well, you were talking about how, in terms of when these services are, it could be anything from, something's kind of going on at school and it could be related to their condition, or they're just not feeling comfortable, or we do have these patients that are here long term. I know a lot of our limb lengthening patients are, they have to go through kind of a lot of processes because they are here for a while, and it's a big thing if they have a frame put on. So can you kind of go into that maybe side, or that relationship of that center?
Sure.
And how you work with them?
So there are several surgeries that we have identified to this point that we like to prepare families and patients before we actually schedule surgery. And we have found that through research and clinically to be very important. It really affects the outcome of the surgery. So while sometimes it seems like, oh, we're delaying scheduling surgery to meet with a psychologist, really we're trying to be proactive about it and think about as many things as we can before we sign up for surgery, so that the other side of it, the rehabilitation, the recovery, and the getting back to normal are as easy as they can be, and the expectations are already laid down, and there's fewer surprises. We do like to eliminate as many surprises as we can. So we've really kind of, over the last 5 to 10 years, really become more of an integrated member of the team. When you talk specifically about limb lengthening, for example, that's a prolonged treatment. And so you're looking at anywhere from wearing a device, whether it's inside, in the bone, or outside, anywhere from 4, 6, 9 months, with the potential of the treatment being about 12 months. And obviously it depends why we're using the device. But because it has the potential of interfering with school, with family, with finances, with friends, in having discomfort as we're trying to move bones and do deformity correction, we want to do the best we can to make sure that the child is leading that discussion and that they know what they're up against and what that requires from them and how things might change, or how can we keep them as normal as possible while they're undergoing this long treatment, and how can we help manage those things to have maybe as least negative impact as possible. You know, we all agree that this is the best treatment, and this is maybe the only treatment, but how can we do it so that the surgery and the outcome are as positive as they can be, even though it can be a hard procedure, for example?
I think it's really cool too, because I mean, these are kids. I mean, we're talking about people who they could be 10 years old, and obviously, yes, I think it's a definitely, you know, you were talking about how parents, I mean, they're part of this process too, and the education and making sure they feel comfortable. But I mean, it's so cool to see that the children are just part of this and making sure they feel comfortable, and they're even just this integrated part into their care, even though they're so young.
They are, and some people say, well, how can you ask an 8-year-old, a 9-year-old, a 10-year-old about what they want or what treatment that they wanted to? And obviously it depends on the age of the child, but it has to be developmentally appropriate, right? And obviously they're part of families, and the parents are signing consent, and all of it goes together.
Right.
I'm not suggesting that anything is isolated. It really is all of us. But it is the child's body part. It is the child's undertaking. And if they are not sure what's coming, or we're surprising them, or they're not on board with at least what the goal of what we're trying to accomplish, like, what are we going to do that's going to make you better or function better or make your pain better? If they're not able to at least identify any of that, then gosh, what are we doing this for? Because you want to have the child have some investment in what they're doing, especially when it's long treatment.
Right.
And having that conversation on an age-appropriate level is really important.
That's awesome. So let's kind of get into the research. I know that we kind of touched on it, but I know that's a big component of what we do at the hospital. I know all of our centers do it, and I know that you guys are a very integrated part into all of that. So can you kind of give us an overview?
Yeah, so in addition to our pediatric psychologists, we actually have the fortune of having a research coordinator dedicated to psychology research, and she is part of the overall clinical research department here at the hospital. What is great about what we do is that most of our research is collaborative. So very little of what we do in psychology is only about psychology, right? Because we're seeing patients who are here at the hospital.
Right.
So they're here for another reason, and psychology is a part of that treatment team. So we are able to collaborate with orthopedics. We collaborate with the hand team and the rheumatology team, as well as neurology and pediatrics. And so one of the major interests that we have, and this is sort of a broad stroke, is looking at what are some of the things that we can identify about patients, families, what we do as a process before a treatment that may help make the after treatment or the rehabilitation or the outcome of treatment better. Sometimes that's things like, I have a kid who worries a lot, and so managing some of that worry before they have a surgery, and so that the worry is not bad or gets worse after. But we want to know what are some of those things that may complicate a surgery or may complicate treatment, so that we can better intervene or better understand what we can do to serve the families better, to provide those treatments. One of the things I think, we had posted recently is about our chronic hip pain patients, and being an integrated member and creating a really interdisciplinary team to look at, let's strengthen from physical therapy, and let's make sure mental health is strong and that we're stable, as well as making sure that the treatment plan makes sense. And all of these coordinated efforts before we plan surgery, so that the outcome is positive, and that the families and really the patients are getting back to doing what they want to be doing, which is the goal.
Definitely.
To increase function, to get them back to what they want to be doing, as easy as possible and as quickly as they can.
Right, because I mean, surgery really is. I mean, it's a big deal. I mean, no matter how old you are, but especially to someone who's so young, and you really have to explain to them what this is, and so there's definitely so much that goes into that.
Sure, or we have lots of kids who take medications who have side effects,
Right.
or may prevent them from functioning the way they want to. But what are some research things? Can we do to better understand? Are there side effects from a mental health standpoint, whether it be medication related or the time at which you're diagnosed with a chronic condition, that we can better understand to better help and intervene at the right time and with the right interventions? So again, that we're fulfilling the mission of the hospital of
Yeah.
getting our kids back to what they want to be doing.
That's great. So I think to kind of finish things out, I know that, I mean, we have trained, like we're going back to the team part, but we do training here.
Yes.
And so can you kind of give insight into what that looks like and what kind of things that, I mean, our psychologists are training future psychologists.
Yes. So we follow a similar model as the medical model. So we talk about our pillars, right, of education and research and clinical care. And we in the psychology department are similar. So we've talked about our clinical interventions. We've talked about our research. And we also have training. So we have a clinical doctoral program. So every year we have a fellow who's a doctoral level psychologist trained in pediatric psychology, who by the end of the year working with us should be licensed as a pediatric psychologist and be able to work with other children who have medical conditions. Sometimes we have pre-doctoral interns that come from an associated medical center here who work with us as well. But every year we have a fellowship. We actually have a director of training, a person here who is particularly dedicated to enhancing and improving our training program, to collaborate with other institutions locally, but to make sure that we're collegial nationwide with our training and with our education.
That's awesome. Very, very cool. Well, thank you so much for joining us
Thank
today.
you, Maggie. I appreciate your time.
Yeah.
And I look forward to talking with you again.
Yeah, it's been great to learn more about psychology, and we'll be back soon. Thank you.